Hello everybody. Today I'll be going to discuss a little bit of healthy talk about a common digestive system problem due to inability to digest lactose, means a type of milk sugar. Lactose is the main sugar in milk and milk products from mammals, human, cows, goats, etc. Lactose is digested by enzyme lactase in the small intestine of the gut. If lactase activity is low, undigested lactose passes into the large bowel, where it can cause symptoms of lactose intolerance. Lactose intolerance is often confused with milk allergy, but it is not an allergy. What are the symptoms you can see in your kids if your kid has lactose intolerance? There can be diarrhea, there can be bloating, flatulence, abdominal pain or cramp or discomfort, stomach rumbling, infantile colic, feeling sick. Now, primary lactose intolerance is very rare, doesn't usually present until 2 years of age, usually later childhood and adulthood due to inherited genetic fault and that runs in families. Secondary lactose intolerance can occur at any age, usually result from different conditions like gastroenteritis, celiac disease, inflammatory bowel disease, surgery to small intestine, or due to taking certain medication. Secondary lactose intolerance means secondary lactase deficiency occurs due to low production of lactase enzyme. Once gut become healthy, the problem is solved. Often you get an improvement in symptoms within 48 hours of removal of lactose from diet. So how can you diagnose it? Lactose intolerance is a clinical diagnosis based on the symptom. Sometimes additional tests may be required in secondary care if symptom persist. There is no relationship between lactose intolerance and adult family member, including mother and the babies. Breast milk contains lactase, and decreasing the dairy content in maternal diet does not alter the amount of lactose in breast milk. So what will be the treatment, isn't it? We have to think about it. A baby with symptom of lactose intolerance should not necessarily be taken off the breast or fed on special lactose-free formula, especially if baby is under 6 months of age. Secondary lactose intolerance temporary, and it improves as the gut heals and initial insult is resolved. Continuing breastfeed or their usual formula will not cause any harm as long as baby is growing okay. Lactase drop such as Colif, Lactase infant drop can be added to the baby's feed to make them digesting lactose easier. It is not recommended to use beyond a week, especially if symptoms do not improve. If there are continued symptoms, lactose-free formula can be considered. Lactose-free formula have greater potential to cause dental caries because of the alternate sugar used in preparing the formula, and therefore parent must know about good dental care. Low lactose or lactose-free formula should not be used for longer than 8 weeks without review and trial of discontinuation of the treatment. So these, whatever I mentioned, it is not in these formulas and these medications are not for milk allergy, as they contain milk protein apart from soy formula, which is milk protein free. So basically, there are few that is available in the market: Infamil, Olact, lactose, sucrose, and fructose free. SMA lactose free means low lactose formula. Aptamil lactose free, low lactose formula. SMA Y soy based formula, which can be used over 6 months of age. which is not recommended to use under 6 months. So this is all about the lactose intolerance a bit to increase the awareness about it. Hope this helped. We'll come with another healthy talk discussion next week. Bye for today.